Well, we're back right here on Hella Kuwait, and I hope everyone out there is enjoying their evening. Right now we have with us a phone call with Dr. Ghanem Alsalem, and he is a consultant in internal medicine and a gastroenterologist. Good evening, doctor.
Good evening, sir. How are you?
I'm fine, thank you. Thank you for taking some time to be with us tonight right here on Hella Kuwait.
Thanks for having me on.
Thank you, doctor. And first off, we'd like to start out, could you please tell us a little bit about iron deficiency, anemia from the your point of view, the gastro point of view, please?
Yeah, thank you for that question. Before I start to answer that question, I would like to really, at the beginning, to thank all our people who are on the front lines facing this COVID-19
That's
pandemic.
right.
As you know, it's been 2 years now or more fighting this ugly virus attacking the whole world. So thanks for them. Thanks for the time and the effort they are making, and we really hope, inshallah, there will be over for this soon after the vaccination being given hope to the humanity to get out of this pandemic.
Very well said.
Thank you very much. So in regard to iron deficiency anemia, as the word says, is where you don't have iron, you develop anemia. Anemia is where you actually don't have enough blood inside your body. So as you know, as a human, we're born with a specific amount of blood inside our body to maintain our health and to give the oxygen and nutrients to the rest of the organs in your body to function in the right way to be alive. So when you have less amount of this fluid going inside circulation, inside your blood vessels, you will experience symptoms. And sometimes the reason behind this is you don't have enough iron to build enough blood. So that's what iron deficiency anemia. And because of that, patients will present to our clinic with different symptoms, complaining of this iron deficiency anemia for different reasons.
So, doctor, what diseases causes low iron levels?
Yeah, there are different kinds of diseases. So, for example, the first one and the most common is where actually you don't have enough food supplements or supplies. You don't eat enough iron. That's one reason. The other reason, maybe if a lady is pregnant, that's another reason. The third one is most common is the regular periods for females. That's another reason. But if you are an adult who is above 45 of the age, we have to look at more serious one. And the serious one may include polyps inside your colon, or you may have ulcers in your stomach. So there are different kinds of reasons to lose iron in your body. And our job as doctors to look into that patient, to take a full history and to do a clinical examination, and then we move on to investigation to look for the reason. Because I want this to be clear for everybody, to our listeners and viewers today. You should not have iron deficiency anemia. Everybody with iron deficiency anemia should be treated, and we should find the cause to treat that first before we give you the iron to supply or to replace what you lost.
So, Dr. Ghanem, what are the symptoms of anemia, please?
So the symptoms of anemia the patients may experience is fatigue. As you know, as we said, this blood you needed to maintain your organs function.
Sure.
So if you don't have that enough fluid or that enough blood in your body, you will start to feel fatigue. You will feel tired most of the time, almost all the time. And sometimes you may experience palpitation. That's where your heart starts to race, because your heart tries to compensate for the loss of blood. So it's to push more blood to your organs and where the organs demand. You may have shortness of breath. You don't feel enough breathing going inside your lungs because you feel tired. See, these are the most common ones. Then, if you continue not to see the doctor and you continue to lose your blood, you may actually lose consciousness one day, and you will be, hit in the hospital, just finding yourself with coma. So these are the most important and signs. So I will ask all our patients who feel tired, who feel fatigue or feel palpitation to come and check their iron and check their blood.
What are the causes, doctor? You mentioned some things before. Tell us more.
Yes, I want to tell you more. I want to tell you most important thing in this review.
Yes.
So I want to make sure everybody listen to this. If you have black stool, if you go to the toilet and you see some black coming out,
yes,
or if you see blood, you're losing blood, you must immediately seek help from your medical advisor. So that's a clinical sign, or that's a serious sign that there is something. If you lose weight and you have iron deficiency anemia, and with weight loss, that also means you need to see your doctor immediately. Because these two symptoms you are having suggest that you are losing blood from something growing inside, and that's what we fear most, cancer. So for that reason, if you have any of these symptoms, you must see your doctor immediately. Now, the other things where you lose iron, and the causes for that is abdominal pain. If you have tummy pain, severe, your pain, if you eat something, you feel really in pain and you cannot sleep from that pain, you need to see your doctor, because ulcer may be there, and you need to do endoscopy to look for that. So these are the main symptoms and the main causes of the iron deficiency. We call them the serious one, the alarming signs one. Where if you have, I repeat them again just to, for the people to understand and to memorize them. If you see black stool, or if you see blood in your back passage, or if you have pain, or if you're losing weight. These are the four main symptoms where I really urge people to look for their doctors and to look for the cause for that iron deficiency.
So, Dr. Ghanem, how can we cure or treat iron deficiency anemia?
Yeah, so we need to investigate first to see the cause for that.
Okay.
And when we know what's causing the iron deficiency, we will tell you to treat that cause, and then the iron will come back and you will have your blood back to normal. So if you... That's the main one. That's the main reason why you see the doctors, to get rid of that cause or the pathology or the disease you are having, to correct that. Now, the other thing is, a doctor suggest that your blood is so much low that we need to give you blood. So that's another way to treat the iron deficiency for a short period. The other one, we may give you iron supply. So the iron we take is either tablets or in your veins, intravenous. So the iron you take through your mouth is where you take the tablets, daily dose. The doctor will sit down with you and explain to you how you take it. And what I advise my patient when they take the iron is to drink orange juice with it, or any vitamin C.
Why is that?
Because it's proven that when you take vitamin C with the iron, the absorption is more. So you will absorb more of the iron where you take. The other thing is, I advise my patients to eat meat, or to eat food with a lot of iron, and we come into that later on. The other thing is, when your doctor advises you to take iron in your intravenous, and that's a drip or IV, as we call it, that needs you to have an arrangement with your doctor, because the iron in the arm will take another half an hour. We stay in the hospital, and then we make sure that you don't have any allergy or reaction to the iron. So these are the main ways of treating iron deficiency anemia. The other thing is, we tell people to look into their nutrition, what they are eating. And especially those who don't eat healthy diet, I really, really advise them to take more healthy diet to correct their iron deficiency.
What food should we avoid if you're anemic? Should you avoid any specific foods that may increase the anemia?
That is a very good question, let me tell you. Yes, there is clinically proven, and we have proved with the science, that drinking tea may actually reduce your iron absorption. So we advise patients not to drink tea immediately after their main meal, and to delay the tea, if they wanted to drink the tea, to later on, after 2 hours or 3 hours from having their meal. The other thing is, we notice that, especially in kids, when they drink too much milk, they don't give the time for the body to absorb their iron. So avoiding milk with the food is a good idea. The other thing is, we want you to stay away from foods which actually we call them low in value. That's the fast food. The fast food, or if you take food with high intake of fat, quick food, they don't have nutritional value, and we advise my patients really strongly to avoid them. And if you just let me, allow
Go
me
ahead.
to tell you what food I want you to eat more to increase your iron in the same context. So we want our patients to eat more of dark green vegetables, like spinach, for example. These are heavy of iron. The other thing is to eat seafood, like fish, shrimp, or whatever. They have a lot of iron and other supplements and vitamins necessary for the body. The other thing is red meat. We advise them to eat more of the red meat. The red meat is full of iron. And let me tell you, organic iron, that's the iron you take from food, is really, really much better than taking iron supplements. The processed iron, or the iron made in factories and given to you by tablets, the value you observe is really less than the one you take from nature, from the food, from the real food. So if you have iron low, really focus on your food, your iron will come back to normal.
Very well said, and it was a pleasure to have you on our program once again, Dr. Ghanem. Thank you so much.
Thank you for having me on. Thank you very much.
Thank you. We'd like to thank our guest, Dr. Ghanem Alsalem, consultant internal medicine and gastroenterologist, for his time with us this evening right here on Hello Kuwait.